Yeah, I'll forget.
Oh no.
All right, Misha,
Okay,
go.
so I graduated in June, and the school that I went to had a health program, and so every couple of months we would go like out onto the field and have like on-the-job training kind of, but we don't get paid or anything. It's just for experience. And so USF was giving us a job placement place. For
Okay, I'm going to pause you. All right, you don't, are you nervous?
Yeah.
All right. You have a nice voice. You're very pleasant to listen to. I think you're making yourself a little small. Remember our power pose comment? So you're making yourself a little small. You need to take command of this space. So I want you again to think about us as a bunch of young kids, and maybe you're telling this story to a kindergarten class. So like just be out there. So you're doing a little fig leaf down here. So you're protecting yourself, which is normal. It's a normal reaction when you're up here. But if you pretend like we're a kindergarten class, you have nothing to be afraid of. So just tell us as big as you possibly can, and just get in our faces and just tell us what you want to tell. All right? Try to get us excited about it.
So USF was giving us a position for the first time. And so when we get there, they teach us how to like assess your patients and like what to do and the steps and stuff. And so usually we have mannequins to practice on and like practice the steps you have to do. And so we went into this room, and so our teacher told us that we were going to have real patients. Like they were like meth addicts or like on drugs or something. So we go into the room, and so the patient's sitting on the bed, and the first lady, she was supposed to be.
Okay, I'm going to pause you. Good, good.
Wait, were they actually on drugs?
I'm getting there.
Oh, gosh.
It's interesting. It's very interesting. I'm curious to see where it goes. So good. You freed this up. This is great. Keep them away from each other and away from your lower extremities. So you get that. Now we're going to, unfortunately, have to remind you when we hear or like. There's some of those littered in there. So we want to clean up the litter and really hear this interesting story. It's going to require some thinking. If the gestures go away, that's fine, because now we're shifting your focus. But if you can process those two things at the same time, great. If not, our primary focus is going to be the non-words. All right? Go for it.
So the lady was sitting on the table, and our teacher would come up to the patient and ask her, "How are you doing today? What brings you here?" And so.
Now take a breath. Click your mind in, tune it in now to this stuff.
I'm gonna get this
and start again. Go ahead.
Our teacher asked the patient, "What are you doing here today?" She said that she was taken to the hospital because she got arrested. So the students, which is us, our job was to ask her questions like, what's your job? What do you do every day? Stuff like that. I asked her what's her job, what she does every day, and she told me her life story. She gets up every day, she takes her kids to school and all that. And basically she looked like a real drug addict. And so after.
Okay, pause, slow down. Now regroup. She looked like a real drug addict.
She looked real. After the session was over, we realized she was actually an actress instead of a real patient. Based on her physical appearance.
After this session, she looked like, and then just cut that out.
After the session, based on her physical looks, she had scabs on her face. On her arms. She had scratches on her face, which would look to you like a drug addict. So,
go ahead. You're good. You're good. You're working really hard, and that we can try to just finish that last thought with no ums or uhs. You're like mastering this. You just said like.
session, she explained to us that she was called as standardized patients, and basically they're actresses that go into colleges and they would act out different illnesses and diseases, so the students can actually get a real life experience on how you would actually deal with patients. And it's not just a mannequin, because if you're assessing a mannequin, they're just like there, it's not doing anything.
Okay, all right. It's really hard work, isn't it? Did you catch a couple of those? You definitely swallowed a couple of them. You felt yourself, and we literally saw it. You will see on the camera. It was a pause instead. Does a pause sound unnatural or weird? No, we much prefer the silence, the space. So promise me you will watch that video, study it, and see the difference. And I could tell your brain was really focused on it. Good work.